I'm Kate Leslie. I'm one of the editors of the special issue for Women in Anaesthesia Research that's coming out in April this year in the BJA. We solicited manuscripts from women researchers doing all sorts of research around the world in anaesthesia, in perioperative medicine, pain medicine, intensive care medicine, and related specialties. And we received some terrific submissions, many of which we've included in this special issue. I don't have time to go through all of them in this video, but I've highlighted a few interesting ones, and I hope that you go to the special issue and read them and the rest of the articles. The first one is about preventing bleeding in hip arthroplasty patients, because bleeding can result in post-operative surgical site infection, which is obviously a disaster. So Dr. Usha Gurunathan and her colleagues from Australia conducted a pharmacokinetic dynamic study about tranexamic acid. And what they showed was that the bolus that we usually use in hip arthroplasty patients is insufficient. And then they simulated that in order to keep a nice high antifibrinolytic level for about 24 hours after the surgery, you needed to follow up that bolus with an infusion. So I'm going to reflect on that paper when I do my next hip arthroplasty. The second study I'd like to highlight comes from Dr. Ginevra Barandio and her colleagues in France. And they're interested in chronic post-surgical pain after cancer surgery. And what they're particularly interested in is whether there are any factors that are emotional or psychological that predict chronic post-surgical pain. So using a rich data set that they've already got and machine learning, they discovered that there are three main predictors: younger age, pain in an area of the body outside where the surgery was going to be done before the operation, and also an emotional feeling of overwhelming worry. So these are three really easy things to measure, and we can recognise those in our cancer patients and put together packages to support and treat their pain better. Dr. Marla Ferschel and her colleagues from San Francisco are really interested in environmental pollution and how it affects anaesthesia. So in a very interesting study, they looked at ground ozone levels in various parts of San Francisco, and they looked at the association between them and adverse respiratory events in pediatric patients having general anaesthesia for elective surgery. And what they showed was that higher ground level ozone was associated with more respiratory events, and that this was compounded in patients who were already at risk, such as those with recent respiratory tract infections and asthma. And one of the things that really piqued my interest about this article was that high ground level ozone is more common in underprivileged areas. So just another one of the poor starts in life that we need to recognise and treat in paediatric patients. Finally, we got some really terrific review articles from some of the greats in women in anaesthesia research. And the one I'd like to highlight here comes from Dr. Isabel Nessel and her colleagues in London, and they provided us with a great editorial about immunometabolism. Now, I'd never heard of immunometabolism, and what it is the interplay between metabolism and immune function when dealing with surgical stress and other types of stress. So if you've got an adaptive response, then your immune system will work really well, even in hypoxic and under perfused environments. But if you've got inflammation, chronic inflammation, and in particular diabetes, then your immune response post-surgery may be inadequate. However, there's good news. There may be things you can do about the anaesthetic and new treatments that will help you in this situation. So to find out more about that, I encourage you all to go and have a look at that review article. So thanks very much for listening. Please go and look at the April edition of the BJA to read some terrific articles by women in anaesthesia research. Thanks so much.